Hi, thanks for joining us on the Nourishing the Community Podcast, where we're going to be talking about all things happening in the community with nonprofits and community needs and how you, the listener, can get involved and make some change. I'm your host, Ladawna Parham. This is my co-host,
Norman Hanks. Welcome to the show.
Thank you so much for joining us today on Nourishing the Community Podcast. I'm Ladawna Parham.
And I'm Norman Hanks, co-hosting. And today in the hot seats, we have Haylee McPherson Bush and Shane Speck from Volunteer Behavioral Health. Hey, guys, how are y'all doing?
Doing well.
Hey, guys. Are we all shocked you remembered the names?
Yes.
I'm very
that was
impressed.
great.
That was
Good
impressive.
job, Norman.
Round of applause.
Good job.
I can't remember our tagline, but by golly, I can't
I'm
remember
going to
your
remember it
names.
today. So the last time he had shut off, there was this long dramatic pause because I forgot to give the tagline. And then right after it shut off, I'm like, no, now I remember. So today, I'm actually going to start us off with that and say, and we are super grateful today to be hosted by our amazing producer, Trent Denson, with Spread the Positive, bringing light to what's going right.
I
Nailed
like that.
it.
I like that.
All
Kind of
right.
like doing it at the beginning better than at the end.
Right?
Anyways,
I like that.
so welcome. We're excited y'all are here. Something's in my eye. I'm just a mess today.
So while he figures himself out, we
Thank
would
you.
love it if you guys would just tell us everything about volunteer behavioral health. And I apologize because
Everything.
Here we
but
go.
there's so much that you guys
There
do
is.
that I think people
Yeah.
don't realize. It's like this whole world that you need to just
Well, why
Get
don't
us
we start a
started
little
on.
easier? So you're located in multiple cities throughout Tennessee.
Correct.
You're based out of Chattanooga, correct?
So we have on my side. We'll say that for right now. So we have three main campuses that provide our inpatient services for our communities, and then Haley's got.
Yeah. So I have the outpatient areas. And as far as what your question is, it's kind of split between Murfreesboro and Chattanooga.
Okay.
So like our president of the company and a lot of our chief officers there in Murfreesboro, and then like financial departments and things like that, that's going to be at our base in Chattanooga.
Okay, cool. So to make it even easier, why don't you tell us a little bit about who you are and what you actually do with volunteer behavioral health? That's a great place to start, right?
Go
No,
ahead.
I'm gonna let
Yeah.
Haley go first.
Okay. So my name is Haylee, like I said.
Hi, Haley.
Hi.
McPherson
Hi,
Bush.
Haley. So I am currently the center director for the Murfreesboro and Smyrna outpatient locations. And I also supervise the care management department for like the Middle Tennessee region. We consider it the West because most of our locations are in the East, but I cover as far west as, Columbia,
Okay.
and as far east as Cookeville.
Oh, wow.
Everywhere in
That's
between.
a huge
Mhm.
Yeah,
Yes.
yeah.
So it's
geographic area.
about 11 different locations. We have a couple of satellite offices placed in our health departments to really grab that
Mhm.
community because that's the population that we serve. But as far as what I do, I am over the operations of the clinics. And I started as a care manager right out of college when I was 23.
So 2 days ago. is what you're-
Yeah.
Pretty-
Oh my God. I'll
Pretty
be.
much.
Shut
I know,
up.
every time you talk about what she does, I'm like,
Yeah.
I will be 29
It
next
must
week.
be hard.
That didn't help, by the way.
29
Right?
next week.
It
That
did
didn't
not.
help.
That didn't. No,
not.
no, no.
But you're adorable.
Thank
Okay.
you. Thank you so much.
And we mean that respectfully.
No, I
For the
appreciate
most
it. I
part,
do.
yeah.
I've come
the
a long
most part.
way, I tell you. Yeah, so I started as a care manager and then team lead, assistant director, and then now I'm director. And it's been a really great journey. I always like to say, I get to help people better. So even though I'm not directly in client care anymore, I still have the opportunity to touch a lot of lives by helping the employees,
Mhm.
by policy, procedure. Something that I really like doing is finding a way to make things really efficient on, a business standpoint, but also the quality care piece as well. So that's a little bit about me.
Awesome,
And what I do.
amazing.
Yeah, and I think it's really cool the idea of helping people help people, right? And Haley and I've talked about this before. Stepping out of that direct client care was really challenging. It was challenging for
I don't
me.
know what you're talking about.
Yeah.
It is very difficult to
It was
do,
almost
you know,
like
and
a grieving process.
Yeah, for
It
sure.
really is.
Almost, because it's like when I started, I was totally okay with being a care manager for the rest of my life. I had my clients and I worked really well with them and I got to see them be successful and I got to do all of these things. But, in turn, your bosses see that and they're like, okay, well, let's move you up a little bit. So I don't get to really have that one-on-one interaction with clients as much as I used to. But I still take, every opportunity I can get to talk to them or see how they're doing or, see if there's anything I can do to help them with their treatment or anything like that. So I'm really appreciative of being able to stay around that.
I
right.
love that. Yeah, it's a learning process, I believe. I
Mhm.
started with Nourish as an intake specialist, so I was used to working one-on-one with the clients and being
Mhm.
right there in their face, right? And now I've grown to a point where
Where he's the interim CEO.
not even supposed to be face to face constantly
Right.
day in and
Right.
day out. I'm not even supposed to be in the building as much as I'm there these days. So it's I'm trying to learn that.
It's hard.
It's
Yeah.
Really hard.
because
It's really
it's
hard.
we do it because we want to help people,
Right. Right.
and it's just hard to see that you're helping from a different
Mm-hmm.
side of it.
Sometimes I can handle the clients better than I can the other
Amen.
employees.
Yes.
I
Mm.
don't know what you're talking about.
Yeah. Yeah. And mourning that process
Yeah.
that took me a long time.
Yeah.
Mm-hmm.
In fact, I still found the other day I got to sit down with I was down at our Chattanooga office and there was a kiddo and his mom sitting out in the lobby and like I just couldn't help. I just sat down right across from this little kid and I was just like, "Hey man, what's your name? Tell me your
Mhm.
story,
Yeah.
what do you do? What's going on?" I mean, I didn't get into out in the open like, "What are you doing here?"
Right.
But,
Right.
like I can't
What's wrong with you?
Yeah, exactly,
What
right?
drama brought you here?
Yeah. But just what's your story? And because to me, I love that.
Yeah.
I love
Mhm.
the story of people because it's what makes up our society and our communities and everybody's got one.
Yeah.
Yeah.
Even if they're totally broken. So so Haley does that with the outpatient stuff. I am the uh, senior director for our crisis continuum in the West. So again, we have 3 campuses. We have our South campus in Chattanooga. We have our North campus in Cookeville, and then we have our West campus here in Murfreesboro. And so I am over all of the what would be the inpatient side of things. Our walk-in center, our crisis stabilization unit, our respite beds, our observation beds, our detox beds, all of that would be what I'm over in our area, as well as our mobile crisis. And so we have mobile crisis in 8 counties in the West. And so we go all the way up to the border of Tennessee. We go down into Williamson County. And so we have people kind of all over that are out in the communities doing calls and assisting with those things. So we're going to be opening our West campus, which I'm really excited about, and we'll share some more about that. But that's what I'm over, and I've only been here in Tennessee for just a minute.
Mm.
Moved back down here in May.
Oh, so you haven't been through
Oh.
Southerners when they say there might be snow yet.
Oh, I have though. Yeah, no, yeah.
It's like, because I am so sorry in advance. for
No.
Learn how to
that.
bake bread.
I lived here from
learning to break,
2000 to
yeah.
2009.
Okay.
And so I went through hey kids, guess what? School's canceled tomorrow because it's going to snow. And they get so excited. And the next
There's
morning,
nothing better.
there's still grass coming up through the snow.
Yeah.
It doesn't matter. School was canceled. We don't have to go.
Yeah.
Period.
Well, it's changed a lot since then too, because now if there's just the thought of snow, they're going to close.
Oh,
school.
yeah.
They're
Oh,
gonna
yeah.
close the school.
But then everybody's going to call up poor James Evans and yell at him and
I
tell him what a
know.
terrible person he
Mhm.
is.
Yeah.
So I'd just like to say to anybody listening, it's not James Evans's fault. Whether they do cancel or don't cancel, he's just the messenger.
He's just the messenger. He
Right.
does not make
Bless
the
it.
decision.
Yeah.
So for everybody who doesn't know what you mean when you say mobile crisis,
Yes.
what does that mean
Yeah.
to the layman?
Sure. So our mobile crisis team, they are individuals that will someone from the community calls in, might be PD might call in. You might have a hospital that would call in, hey, we've got someone that was brought in. We need someone to come do an assessment. You might have a family member that calls in and says, I've got a loved one here at home and they're in crisis right now. We need someone to come out. And so our mobile crisis team will dispatch from their locations and go into the community and do a mental health assessment and kind of determine the level of care, the services that they might need, all the way from maybe it's detox, maybe it's a crisis stabilization unit, maybe they need outpatient services, or maybe they need something a little bit more. They might need to be on an O4, a committal, where they've got some more persistent mental health concerns, and so they're going to get all of that facilitated and try to get those people to a safe space.
Do you have any CSUs here in Rutherford County? And what age groups do they serve?
We are about to. Yeah.
So you do not yet?
Yeah, we do not yet.
Okay. How many beds will it have when you get it open?
So we will have a total of 30 beds.
Okay. So for adults?
It will be 18 and over.
Okay.
The uninsured.
There you go.
There we go.
The piece that he likes to miss. It's a big
Like
piece.
one time I missed
piece.
that when we were talking to somebody and she was like, and I think it was with you, actually.
I do remember
Perhaps.
us having the discussion
Yes.
about how important that is.
And when
but
she reached across and hit me, and she was, so yeah, 18 and over, and just providing that stabilization for them. Of that 30 beds, we will have beds that are dedicated to detox, and we would do medically monitored detox. So we do not do medically managed. That would be a hospital level detox. And then we'll have our crisis stabilization beds. We'll have 15 of those. And then our respite beds for individuals that, they just might need, a day or 2 or 3 days just to kind of settle.
And how do we get there? I need a respite bed.
Absolutely.
Now I could use one.
Haley is dispatching someone right now to this
Haley.
location.
Yeah. That's
Thank you,
me.
Haley.
To
I'll
do
be
a-
waiting.
Yours, however,
No,
isn't really a crisis situation. Yours is more just ongoing
Ongoing
status.
Got it.
So I'd like
Maybe
to
I need a
refer you
massage.
to our outpatient facility.
Yeah,
And
yeah.
Haley
Maybe
can
anyway.
provide.
Right? You're all the things.
I'm all the things.
All the things, Haley.
You have no idea. All the
Helping
things.
So
people
that's
help people
exciting.
better.
Yes.
When do y'all foresee this new facility opening?
So we're hoping that our facility will be open first quarter of next year. We're
Great.
currently in the final stages of our build,
Okay.
and looking forward to a community kind of an open house, to bring our community partners in, let them see what we have, let them see what we're doing.
Which
And
you're invited to, by the way.
absolutely,
We're a
How
community partner.
exciting.
We're so
absolutely, yes. In fact, I saw the other day that when we came to that business after hours,
Yes.
which was way cool, by the way.
Yes.
awesome.
I was like, man, this would be pretty cool to have something like this
Oh, yeah.
on the outpatient side of our building, to host one of those.
Mm.
Yeah.
But anyway,
Would love to get that kind of inside understanding.
yeah.
Mhm.
So we're
And we
hoping
throw
first
a
quarter.
great party. I mean, let's be
We do
honest.
throw a good party.
It's been very
It
loud.
really was.
Yeah.
It really was. We did not have our $15, and they still let us in,
Oh,
and
that's
still gave us
nice.
That was
tickets.
so nice.
That was.
Yeah.
So
Yeah.
now we have a free pass for the next one.
Yeah.
too.
Oh, yay.
Right.
They're
Yeah.
trying to recruit you.
Yeah.
They were,
We
and I
went
thought
to
it-
the orientation.
It's like
Yeah, we did the next
yeah.
on that Friday. We went to the.
We'll
We
make
did.
sure you put down that we referred you guys.
Mhm, absolutely. Yeah.
The cult leaders need to know who's sending people. their
Oh,
way.
for sure.
Okay.
Yeah, I thought it was cool. We walked up. They said, "Are you on the list?" And I was like,
Yeah,
like,
the
yeah,
list.
"Oh, that's awesome!"
No idea.
But we were not on the list, by the way.
Bouncers.
So yeah, first quarter of 24 is we're hoping. Really, it's just going to come down to our staffing, which I'm sure everybody deals with that, right? Your
Mhm.
staffing is your
I
issues.
love it.
Mhm.
So
Yeah. So
Well,
when
and-
we all start hiring for those positions?
we're going to
Because
begin.
it's a 24-hour site,
It
right?
is,
So
yeah.
you're going to have all the shifts covered.
Yep. Nurses, techs. I mean, everything.
Yeah. Janitorial.
Yeah. Or I'll do that.
I doubt it.
I mean, I would.
I mean, I'm not saying
I
you
doubt
wouldn't.
it.
I would do it as well, but
Yeah.
I mean, we've all been chief bottle washer at some
Yeah.
point.
Oh yeah.
all day, every day.
Yeah.
Yeah.
I've got a chair to go shampoo. Well, so
Yeah.
Yeah. I'm going
Yeah,
to
back
create
at the
the
office.
CVO, the chief vacuum officer.
Yeah.
I like
And,
that.
and let that. I'll take that position.
Heck yeah.
Yeah.
So yeah, we're kind of in the process right now. We're hiring support staff that can help kind of lead those things, get them trained. And then we'll start hiring our nursing staff probably after the first of the year. I mean, if I had a nurse that's listening to this that was like, I want to work at volunteer, and they reached out to me, I wouldn't.
Well, it's
wouldn't
funny. There's
not
no
hire
job
them.
listings on your website because I looked before I came over here today.
He said, I look.
First of all, I've got clients that need jobs.
Simmer down.
I can
Yeah.
send you
Second
the
of
link.
all, okay.
That would be awesome.
Yeah,
Thank you.
they've not posted the nursing sites
Yeah.
yet, or the nursing jobs yet, because we haven't officially begun the hiring
Yeah.
for those. But I would imagine those will be up fairly soon. I think we figured with the holidays.
Right,
And when
right,
you
right.
are
really
ready for
struggle
that,
with
if you will send us that, we'll certainly give it to
Absolutely.
Heather, our Nourishing the Whole coordinator that you guys will be working with. But we can also post that and share that on our.
Absolutely be
pages.
awesome.
Yeah. We have a lot of friends that do a lot of different things. So
Yeah,
yeah, we'd love to share it out.
yeah.
We'll take them.
Definitely looking for the people that are passionate about mental health. And
Absolutely.
anybody that works in the field knows the underlying message of what I'm saying in that, right?
Mhm.
I mean, it is
Yes.
for the service, it is for the heart of the
Yeah,
people.
yeah.
Because you could definitely walk somewhere else and make more money.
Yeah.
Yeah.
Yeah, we're the
nonprofit
helping
life, we
profession.
get
Yeah, right.
Yeah. Yeah. So love all of that. I worked in a CSU for a while, so it's
did you?
exciting to learn. Yeah, but it was a child one,
Okay.
Mm.
which was a lot more interesting.
Yeah.
Yeah, kids are great. And they have no
But
boundaries.
you have to have the heart for it.
You
Yeah.
have to
Boy,
You
have
have
do
to have
you
a heart
ever-
Yeah.
for kids. Yeah.
I
It does
couldn't do
not pay
that.
for nothing. But
I
you've
would be in
gotta
emotional
love what you
basket
do.
case all the
Mhm.
time. So for me, it absolutely just thinking about that, but also going back to that grieving process of not doing the direct
Mm-hmm.
client
Mhm.
work. While yes, that is super true, and it is a lot harder. You don't have that same sort of motivation. It has to be more intrinsic. You don't get that gratification of I directly serve this client and have
Yeah.
that interface and wow, they're helped. That helping people help people is really a step. However, for me, could not go back to direct care because I don't
Couldn't.
have boundaries. I don't
Couldn't
have
be me.
boundaries at all. I don't
Mhm.
I lack that capacity. I take
difficult.
it all home with
Mhm.
me.
It's
I'm
very
just
difficult.
I'm a hot mess.
Yeah.
I'm a hot mess. I
Yeah.
cannot. I will cry with them. I will
Oh, yeah.
stay up all night long. I don't have it.
Worry
So
about them. Work
But on
late
this
for
side,
them.
yeah, but on this side, you don't have the great stories either, right? Like watching the kid attack the RN that's in there to give him his shot and like biting a
Oh.
chunk out of her face and
That's
like
very
the fuck,
interesting.
like
Yeah.
how do we stop this and
Yeah.
get all hands on and in it? Yeah. Or the client who can't feed their family this week because their car fell apart and they have to get that done and the bills are too late and they can't.
Mhm.
see,
And
I
I'm ready
have
to go
make
to the grocery store and buy them
Yes.
all the
Right,
things.
Right.
Yeah.
Well,
Mhm.
we have a
Yep.
grocery store. So
Yeah, you guys can provide that service for them.
Yeah.
Absolutely.
Yeah.
yeah, we
Whereas
love it.
I'm like, I can drive you, or here's just my car.
Yeah.
Like,
Yeah.
here's just-
Right.
Take the key to my
What?
house. All of
Yes.
the take
So
it.
I'm much better. Like, let's just make sure we have all of the resources we need.
Mhm.
Yeah.
How do we problem solve this? What partners do we bring
Yeah.
in? Like being on that side of things is definitely more more
And
my
Yeah.
pace.
on top of that, it's funny that you put it that way because again, I'm the same way, and I think that's why I enjoy doing things like this because if I have a client or an employee has a client that needs something, I can say, okay, send them to me. I have this direct person that I know can
Yes.
immediately help them. So having all of these different networking relationships with common people, like people that are serving the same population that we
Did she
do.
just call us common?
Not
Common
common.
likeness.
Common
Common
likeness
passion.
in the
What?
head. And
Uncommonly
Hello.
common.
Kayla, you're my people.
Stop
I
it,
like
thanks.
it.
You are
Keep
common
going.
in the head.
I can't.
But that's the I think that's I like it. I like that being able to have like a warm handoff. And
Mhm.
I have the client and I can hand them
Yeah.
off to you, and I'm
Yes.
confident that they're going to be taken care of the same way that I would take care of.
Mm-hmm.
And that confidence piece is so important. You know, we've talked several times with different groups that we've had on about how we believe really passionately that you cannot be successful working in a silo. Not
Yeah,
long
Oh my
term,
God.
talk about
not
this
for
all the
your,
time.
you
Oh my
know.
gosh, yeah.
Yeah. And so we're all about those partnerships, but it is so important that you have faith in those partnerships and that
Mhm.
you know that it is a warm handoff. It isn't just a handoff, and that you can walk with them and you can call those people up and say,
Mhm.
how are they doing? What do they need? Let me get this over to you.
Mhm.
And that it really is a partnership, not just a here's a number, go call them. I wish you the best of luck. And so
Exactly.
Yeah.
there's a difference there. And that's what we really mean when we say, don't be in a silo handing out phone numbers, work in partnership and
Yes.
collective.
Well,
Yeah.
and I think when we get out of the silo, our recidivism in our communities drops.
Mhm.
Absolutely.
I mean, because you're connecting them with, what we see is we see them in my world, right? I oftentimes talk about like they start with me and then they go to Haley, right?
Mhm.
Mhm.
Like
Right.
they start in that moment of crisis, and it's very little in that moment of crisis to see 2 weeks down the road, right? It's very
Oh,
little
yeah.
to see actually having a place to live. It's very little. I
We
mean,
talk about this a lot.
yeah, right, right.
Yeah.
I
Yeah,
mean,
because how do you think past the moment you're in when you're in a
right.
crisis situation? And our clients live
In a
in a
crisis
crisis
situation.
Of course they do.
situation.
Every
Like
moment.
it's
Every
a
moment.
constant
Right.
ongoing. So minute over minute over minute, it's how do I breathe right now? And how do I
Mhm.
put
Mhm.
this soda in my mouth so that I have something to drink? And the next minute, where's the food
Yeah.
going to be?
Right.
Yeah,
Right.
it's planning ahead is not something that our clients have
The
the
luxury
luxury of
of.
doing.
No, and if you know what you're going back out to, right? So I
Mhm.
mean, if they're in our CSU and they're there for 5 to 7 days, that's great. I mean, that's an amazing rest for
Mhm.
them, and that's an amazing opportunity. But if all we do is expect that now you've had 5 to 7 days to
You're
to
cured.
reset, you're gonna. We
Right.
know that they're walking right back out the door to their coping mechanisms,
Right.
right,
Right.
to their function, and having that. I like Haley said that handoff, right? Like you're going to go up to outpatient, and we're not just going to tell you to go there. We're going to walk you there. We're going to show
Mhm.
you where it's at. We're going to introduce you to your clinician. But even outside of that coming over and meeting with y'all, and we talked that day about
Mhm.
the ability to say, as you're in that therapy space, but it's identified at that admission, right?
Right.
What are some things? What are your barriers? What are your hangups that
Mhm.
cause you to be in constant crisis,
Mhm.
so that we can plug them in with community resources? And I mean, you've got your people that they take the system, and that's what they do. I mean, they want to be homeless. They want to, that's just the
Mhm.
life they've chosen. But it's the people that we can catch that don't. and
Mhm.
and that's an awesome story to be able to tell. It's so cool.
It is. And the people that aren't the people that you can help long term, it is such a small
Yeah,
percentage
it is.
of that whole. And I think that's important for us to share too, because there is such a myth out there and we deal with it
Yeah, no.
so often. Of people believing that that is the majority and that
Yeah.
people are just out there using it and taking advantage of it and they don't really need it. And I mean, I will never forget, and I know I have said this 92 times and I apologize, but when we were in the height of 2020 and everything was
Mhm.
so crazy, we were fortunate that we had a number of community volunteers because we never closed down, and we would have cars lined up around the block
Yeah.
and down the corner and multiple lines. Um, but we had these great volunteers, but this happens more than this, but this one lady came in and she just came in all in a tizzy after rolling a cart out to somebody's car. And she's like, I just can't believe that you aren't out here checking that these people are really deserving. I mean, this woman was in a Nissan, and not like an
Oh,
old
Oh,
Lord.
stop
Nissan.
now.
It was like a Nissan Maxima or something like that. And she goes, it wasn't an old Nissan either. Like, you don't have any kind of quality control? I mean, she was all upset. First of all, it is, it is not our place to sit in judgment over what's
Mhm.
happening
Mm-mm.
in anybody's life. Second, a lot of people have lost their jobs right now as
Yeah.
everything has closed down, and we don't know whether they've lost their job, whether they've had medical issues,
Mhm.
whether they have a special needs child and that's eating that up. We have no idea
Yep.
what's happening in their life, that they were able to have that car and now they can't, but they're upside down and they
Right.
still have to have a car to get to work. Like they're doing all of
Or
the
that
or
car
the
is their
hospital
house.
or
Yeah.
that car is
Right.
their house. We don't know any of that, so we don't judge.
Mm-hmm.
That's not our place.
Yeah, and when I say, you've got people that want to be, right, that homeless population or
Their
whatever it might
comfort
be.
zone.
I mean, it that is also a learned
But
behavior. You think like
I was going to say,
therapeutically,
but at some
Mhm.
point, we can't necessarily say that they want
right? It's what they
to be
know.
homeless. It's what their brain is used to,
Yeah.
right? So
Right.
they're still in. If we can find the trigger that will help
Right.
them reprocess, right, and realize that that's not the way you're supposed to live.
Mm-hmm.
That's not the way you have to live. A lot of times, maybe they just don't know there's resources out there to help
Yeah.
either,
Yeah.
right? So it's easier to be living in a tent on top of a pallet that you picked up from the local food bank
Mm-hmm.
out in the woods somewhere than it is trying to find help to get you into a more structured home.
Well, and then
Word.
too,
Yeah.
yes. And then we talked about this the other day
Sorry.
as well. People with certain kinds of mental health needs,
Mm-hmm.
Mhm.
the paranoia that comes with that of any kind of structured
Mhm.
place. You know, we
Mhm.
have had somebody take apart the toilet paper holder
yeah.
in the
Right.
bathroom because they thought there were voices coming out of it. You
Yeah.
know, like you just
Yeah.
they're not going to go into a place where they feel like something bad is going to happen to them.
Mhm.
It's more,
Yeah.
so there's all sorts of things. But yes, even within that structure of the people that we're not going to be able to help because we're not in a position to meet that
Mm-hmm.
level of
Mhm.
need. There's so many that we can, and that's why places like y'all's is so important because it really is that transition piece from crisis towards sustainability.
Yeah.
It
Mhm.
moves them forward in that
Yeah.
process.
I
Yeah.
like to think of outpatient as that this is your plan ahead.
Yeah.
You have the people who are in crisis every single day.
Mhm.
Always thinking about what's going to happen next or how it's going to happen. And, you start again with Shane and then we are the plan ahead. You start coming, we make a treatment plan, we talk about what you want to see out of life and we figure out a way together of how to accomplish that. And we try to make it very client focused. There's not any two clients are the same and their situations will never be the same, even if their diagnoses are the same.
Mhm.
Mhm.
And everything presents differently. And, what is a goal for me may not be the same goal for you, even if we were both homeless. And so I think it's very important that, in that plan ahead outpatient side, that we're able to really make it client focused and baby steps. We like to celebrate the small victories. We're not going to say, okay, you're homeless and 6 months from now you're going to buy a house. That's what we're going to do. We want to make it to where it's easily achievable for them and also easily achievable for us because we don't want to make promises that we can't keep, but as
Mhm.
long as we're working with the client step by step in those small baby steps, there the amount of successes that we've seen and the independence that we've seen come out of some of these clients is insane.
Yeah.
Yeah.
And the importance of those all-encompassing services, I think, is so
Mhm.
important. I love what volunteer does. I
Mhm.
love that they can get people in the moment of crisis, and then we can carry them all the way to that outpatient. But we
Access
also
to care.
recognize that what we're working with is that mental health side, right?
Yeah.
And that is so important. But still, a lot of times, that's we can help them set goals. But if we don't have partnerships of kind of like Nourish, I mean, when we left y'all that day, Haley and I are both like, "Oh my gosh,"
Mhm.
like what an amazing
I'm
opportunity.
so glad I wasn't there. I'm glad they got to meet the smart team.
But what an amazing
And
opportunity.
not the
I
pretty
know.
team. He literally just rude.
You get one or the other,
Rude.
maybe. You
Rude.
can't have both. I'm sorry.
Wow, wow.
No, I'm kidding. They're
But
both
I mean, we
gorgeous.
worked with people all the time in my previous life and doing private practice. I mean, you get people that come in, and especially if you're working with people that are involved in the system at all, And I remember one in particular. It was just so frustrating that the things this individual had to do to get their kids back, right? And I'm not dogging, any of those services, but
But the systems make
the
it so
the
difficult.
the system,
Mhm.
the amount of meetings he had to go to a week, and the full-time job he had to maintain,
Mm-hmm.
and he didn't have a car, and everything was by bicycle or bus,
Mhm.
and if he didn't show up for certain, I mean, like, but all I could
Yeah.
deal with was that mental health,
Mhm.
because
Mhm.
we didn't have partnerships in the community to say, like, here's where you can get some of that food met, or here's what you can help to get housing, or here's what you can get for
Mhm.
that. And that's why I think those partnerships are so important, because it's not a competition, right? It's not
Right.
a, we want to fix them so that we can say, look how many people we fixed,
Right.
because we don't,
Yeah.
and
You just
they
want
might
people to
bounce
be
to you
better.
guys and then back to us 4 or 5 times.
Mm-hmm.
And
And I think that's so important for people to understand too, because it is such a fragile
yeah,
ecosystem. They're living right on that bubble. And there are so many systemic barriers in place that if one piece
right,
falls apart, like you have to have this job, or the court's going to say, well, you aren't gainfully employed. You can't do this.
right,
But you have to make all of these meetings that are during the day when you have no transportation and no childcare and none of these things.
And let's
And
be
your
honest,
job.
public transportation is crap in
Uh-huh.
Rutherford
Yeah.
County, okay?
We do have the bus stop right at our
Yeah, we do
driveway, though.
too.
Awesome. See, they can
So
come
How
right
often does
between the.
it come by there?
But, if your job is like, if you miss one more day,
Mhm.
you're fired. Well, then they're choosing between I'm missing that court
yep,
appointment or I'm losing the job. And then the court's going to say I didn't do it anyway.
yep,
And then they're back
Yeah.
and the bubble pops.
yep,
And I
Mhm.
think it's really hard for people who aren't living on the edge of that soap bubble to understand
Oh, yeah.
what that's like, how that deepens any mental health strain that you're having, and dealing in crisis when you're in crisis is
hmm,
not effective.
yep,
We've talked about the being in a horror movie effect. When you're watching a horror movie, you're like, don't go in the scary room. What is
right,
Right.
wrong with you? But when you're in the horror movie, you're like, I think my kid's in there and I heard a voice. I have to go in the scary
Yeah.
hmm,
room. When you're in crisis, you can't deal with crisis effectively. And so having that crisis management piece, moving through the outpatient piece, and having the partnerships, just rounding it out, it really
yeah,
is a great fit.
yeah, yeah. And I think making sure that they understand their services.
Mhm.
I mean, let's be honest. I think most of our society, we are one catastrophe or two catastrophes. We're not very many degrees removed from,
Mhm.
No.
we could ourselves be in a spot that
Oh,
we
yeah.
just can't handle it anymore. And
Mhm.
unless we hear that story, right? Unless we know what that was, if all we do is assume, well, you're just a constant consumer of services, and we never hear, so what was the genesis of this, right? Like, what
Mhm.
what got you to this place, and be willing to walk back with them to that spot, and help them see how, not how I can help you take those steps, but help them see how you can take these few steps, and you can get yourself to a place that is better. And then once you see those little victories,
Yeah.
and it might just be, I made it,
Yeah.
I made it through a week. I made it through a
Mhm.
day.
Yeah. No, that's true. It's so true. It's
Yeah. I actually had a client the other day, and it started out, a client complaint, and she just, wanted someone to listen to her
mhm.
and talk to her for a really long time. And
She said a really long time.
about an hour. And by the end of it, she was telling me what her goal was for that day. And it was like, I want to take a shower and I want to hang this picture. And by the end of that evening, she had completed her shower and she took a picture of the picture hung in her living room.
Mm,
And it just like, those are the things that get me,
Yeah.
because it's like you make those small differences, and
And those small differences are
oh,
so huge,
be-
especially.
because it's huge for them too.
yeah.
Yes,
And I
that's
will
exactly
testify.
it.
I got a text that night saying picture was hung.
Picture was hung.
Yeah,
And
I
I
mean, that's a
just,
huge step for that
Mhm.
person.
my first thought, because she talked about it earlier in the day, was, what?
Yeah,
Yeah.
You
but
hung
it's
you hung a
my
picture?
little social
So
work
then I had to
card.
get
And I love
context
it.
of, oh, that's right.
Yes.
Yeah.
That's amazing.
It's my favorite.
Yeah.
Those moments make it worth it.
Yeah.
Just
Absolutely.
a picture hung.
Absolutely.
Mhm.
Yeah. And what it is that volunteer does in our communities, I think is transitional. and it's transformational for people. Um, where the state I came from, I mean, they were closing hospital facilities, mental health facilities, like right and left, but at the same time saying mental health is a real problem in our state. We
Yeah.
need to address it.
Mhm.
And I don't know enough about kind of where Tennessee is at. I know they've limited some beds as well, but I can
Zero
say
commentary on that.
but Tennessee does some things that other states don't. We didn't have any of these services in the state I came from.
Wow.
No mobile crisis, no CSUs, none of that. I mean, we had therapists, we had offices, we had people that go out and work with people in the community if you're plugged into, CPS or something like that, but we didn't have anything like this. And so even what they are providing is pretty phenomenal because it gives you the opportunity to help those people pause, and now we can get them plugged into services. Whereas if they came into me as a private practice individual, right? I'm like, I don't know. I don't know where I'm going to send you. I don't know what we're going to do. And I've only got a few minutes to kind of figure that out.
Right.
And I think that's what's pretty cool about what Volunteer does, but also what these partnerships do in the community.
Absolutely. So, if somebody needed help or knew somebody who needed help, what are the best ways for them to get in touch?
Okay, so I think this might be my piece. If they are not in crisis, at least. So one of the things that kind of blossomed through the pandemic was, the access to care. Um, everything was shut down. We normally had intakes come into the office, new appointments, first time appointments, whatever. We could get them scheduled within a week or two. They come in, but with the pandemic, it was skeleton crew in the office. No one was in. And so we developed this system, and I'm pretty confident to say it's the only mental health facility or agency that does this in the state. But we have an on demand intake system. So you call the number, you get an intake. You get the psych evaluation, you get a care management visit, and you get a medication visit all in that same day. Instead of, okay, I'm doing my intake. Well, your first medication appointment is going to be scheduled in the next 3 months or something like that. And I think that that's really great because especially with this population, your mind is going to change all of the time. And when you reach out for help, that's whenever you need the help. You're not planning to
Right.
need help,
Right.
2 weeks from now. You want the help now. And so it's very easy. You just call the number and you get your appointment, and it's all over the phone. You don't have to come in either. And so we've done a lot of work with trying to have more of like hybrid models. So if you can't make it in, then you can call us and we'll do your appointment over the phone, or we'll FaceTime you and do a video appointment. Or
That's
if you want to
awesome.
come in, come in. And I think that that really helps, the situations that the both of you were talking about with, okay, do I make my med appointment or do I go to work? But we've made it to where you don't have to drive all the way to the office for a 15-minute med appointment and then drive back to work or take the day off. You can just simply take a 15-minute break and have your med appointment. Your script is sent, because we don't want people to have to choose between their mental health and their
Right.
livelihood. And
Mhm.
so we really, really worked hard to figure out a system for that.
Mhm.
And so we've been able to help more people. I mean, I think we increased our rate of admission or intakes from 55% to like 83 with that process because again,
That's great.
transportation
Yeah.
or
All the
all the
barriers.
things,
Yeah.
all the things. So it's just really helpful. And you can also walk into any of the locations and say, I would like an appointment, a first time appointment, and we'll take care of you there too. Cause you may not have a phone. If the bus drops you off at our doorstep, then we're going to help you then. And so that's kind of how we like to do things.
Yeah, and on the crisis side, especially once our campus down here is open, I mean, we will have a 24/7 walk-in center. So literally, and because the bus will drop you right off in at the front of our building, I mean, you just you walk in, and it doesn't have to be. I mean, it doesn't have to be, you know, overly, dramatic. It doesn't have to be you have to be crying or anything like that. Just walk in, hey, I need some help. I'm in, I feel like things aren't going okay. Doesn't have to be I'm in a mental health break or anything like that. I just, I need some help. And we're going to have people are going to sit down with you, assess you 24/7. And then we'll help kind of determine those next steps, what might be appropriate for you. And sometimes it's like you need medical assistance, and so we're gonna make sure that we get you plugged in with medical assistance. Or if
Okay,
you
I'm
know
going
some of
to
these
ask you a
partners, yeah.
question. I'm sorry to interrupt
No, you're
you,
fine.
but y'all keep saying mental health costs a lot to
Mhm.
take care of. So how do your clients pay for it?
So we
Because
have
you've
a
already said
sliding
you don't do
scale.
private practice. It's
Right.
right.
We don't really take commercial insurance. We are for the underserved. So we are the TennCare population and the uninsured population. So we have a grant that will cover services. It's called Safety Net. And if you fall within an income limit, all of your services will be covered. And it's a grant from the state. Again, we have TennCare. We accept all 3 TennCares. And we also have sliding scale. So very, very small copay for things if you're outside of that income limit for that grant.
And for us, it's
Mhm.
the uninsured, it's the TennCare. But we don't want people to have that barrier of, I can't afford anything or whatever. So what am I going to do? And if somebody were to come to us and they have private insurance, it's not like we're going to, you can't walk in the door.
Yeah, absolutely not.
We're going to make sure that we're going to at least plug them in with services before they go. So they've got a plan.
Mm-hmm.
Right.
And that's, I don't want that to seem exclusionary, but there is a large population of uninsured or TennCare individuals that they don't have access to the services that people with insurance have.
Mm-hmm.
And it's not to say, well, you guys have services, but these people don't. But I think that's really important that we're helping to meet the needs of those individuals, and they don't have to worry about, am I going to get a bill? And I already
Mhm.
can't pay my bills.
Right, because
Mhm.
that's more crisis,
Right.
right?
Right,
Like,
exactly.
Yeah,
yeah,
exactly.
we're just perpetuating
That's
the
what we're
system.
here
Right.
for. We're going to help you,
Right.
teach you how to pay.
Yeah.
Right, exactly. Yeah.
Yeah.
And so then even plug it in with you guys, if somebody that's plugged in with Nourish and you guys know that, in fact, just after we met with you I think the second time, like we got back to the office and we got a call like, hey, we've got somebody. What would you think? I
Oh,
mean,
yeah.
it was awesome. Like
Yeah.
right away.
Yeah.
Mhm.
And we
Good.
got to plug them in and we got to help just in that moment. So I mean,
Mhm.
it was great.
That's awesome.
And that's what we want is not just we'll get people to other services, but other services are aware of us and can send
Mhm.
people our way as well.
Mhm.
Awesome.
Yeah. Heather is excited about the partnership with you all.
Oh, we're so
Like she
excited. We're
just,
so excited.
yeah.
Yeah.
It's just another opportunity. Like I said, we have some employees in satellite offices in our health departments. Like we're trying to expand that
Mm-hmm.
side because
Mhm.
that's a need right there. It's you've
Yeah.
got your physical health and your mental health, which is what, being the care management supervisor, I like to talk about this, but it's so much more than just the typical case manager. So we're not going to surprise drop in at your house. It's not the random home visits and it's not, you know, just talking about your mental health. This department, the care management department, is really there to reach the whole person. So, you're coming to me and you have schizophrenia and we need to help you with your mental health, but you're also a diabetic. And so we're going to make sure that you're getting your eye exam done, you're getting your lab work done, you have information for diabetic diets and things like that. Because if your physical health is suffering, your mental health is going to suffer and vice
Right.
versa.
Mhm.
So that's something that it's just the whole person. And so
Mhm.
being in these places like Nourish and like the health departments and things like that, you're able to, okay, you've got your mental health here, you can get your food here, you can do all of these
Mhm.
different things. And I think that's where we can really make a difference is in those, it's not necessarily in the big tall buildings,
Right.
where our
Right.
offices are. It's in the community where people are
People are.
getting the things that they
Yeah.
need.
Yeah.
And I
Well, I was going to say, and so that's, I'm going to plug some other services that Volunteer provides.
Oh, there's so
please
many.
do.
I know, but
I have like a
but
list.
I'm super excited about these, and I want to be sure we don't miss them. So we have co-responders that are in. We've got them in Murfreesboro. We've got them in a number of our areas. Wilson County, we have
Sumner.
Yeah, they're in Chattanooga, they're in Cookeville, and kind of sparsed out in between. But they are literally embedded in local PDs.
Mhm.
We're hopeful that we get a co-responder with Rutherford County Sheriff's Department,
Mhm.
and they ride along with the officers. And I think this has just it's been phenomenal because
It was the most amazing program.
yeah, they're gonna go out to scenes and situations where maybe historically the response would have been, we're gonna pick this person up and take them to
Mhm.
jail,
Mhm.
Mhm.
you know, and it's not a jail situation,
Mhm.
you know, and so our co-responders can kind of help assess on scene and then get those people plugged in with mental health services. And so our partnership with local law enforcement would be that they're going to take them from that scene or from that situation. They're going to bring them to us.
Mhm.
They're going to bring them to our campuses.
Mhm.
And even though we're not physically open in Murfreesboro yet, we can still refer them to Cookeville and to Chattanooga, and then make sure they get their transportation there as well.
Yes,
So it doesn't,
transportation. We
Mhm.
help with that.
so it doesn't
also.
just have to be wait until we're open and then we can help you,
Right.
but we can get you to those services there. And the other thing that we've also started is our behavioral health liaison program, and so
Mhm.
we are putting some of our mobile crisis in local ERs, and so when someone's brought into the hospital, I mean, let's be honest, your nurses and your doctors at hospitals, they're not trained for the mental health side, right?
Right.
They're looking for broken bones. They're looking for something that you can scan and you
Gosh.
can see, okay, I can deal with that.
Mhm.
But if you're not going to be able to scan for that, you're not going to see that mental health situation. And
Mhm.
so having our liaisons in the EDs where they can help to assess the mental health side of things, and where they can then help to make those referrals, because you might have somebody that's sitting in a local ER somewhere, and they don't need to be in the ER.
Mhm.
You know,
Mhm.
maybe they just need our CSU, our stabilization unit, and so we can transfer them over there, and then not clog up your ERs,
Right.
which increases wait time for people who are having serious medical concerns.
Mhm.
And so that's been really, really cool that we're starting those partnerships, and we've been creating those relationships with hospitals in our counties. We've already got a number of them down in our southern counties and in our northern counties, but putting those people there has been really, really awesome. Again, finding ways that we can truly meet people where they're at
Mhm.
Mhm.
in the moment of crisis, and help transition them along.
Mhm. I want to
That's
say one of
awesome.
the in the first quarter of that co-responder program, it was maybe out of 75 mental health calls, there were only 2 of them that resulted in incarceration.
Hmm.
And so I think that that's a really, really big deal. And, as an agency, we also have funding to provide these trainings to law enforcement, fire, EMT, and all of these things for the crisis intervention,
Mhm.
teaching those de-escalation techniques, as well as mental health first aid classes. You know, uh, and it's open to the community. People in agencies can attend, community members can attend, and I think it's a really great way to bring everybody together because, again, silos, it's law enforcement, then you have mental health, and then you've got, and a lot of times we might butt heads
Right.
because, I may not agree with just sending the person to jail just because they need a place to sleep or,
Right.
so I think that really connecting all of those community resources and it kind of a united front almost
Mhm.
like, you know, you may be causing a ruckus at the house and the police are called or something, but the co-responder comes out and they're like, "Okay, let's calm down. Let's reevaluate the situation. No one's got to go to jail tonight. How about we go to a respite bed because it
Mhm.
seems like you need a break."
Right.
And so I think that is it's just very progressive. It's very progressive.
It does feel like sort of the next evolution of, back in the day, if somebody had anything from a cognitive or developmental barrier
Mhm.
to a mental health issue, they were immediately institutionalized
Oh yeah.
and
Yeah.
and labeled, and there was no help
Mhm.
and integration where they were at.
Mhm.
And so fortunately we don't, typically do that anymore,
Yeah.
but we're still doing versions of that today,
Mhm.
just, in kind of a more microcosm
Hmm.
arena. And so this definitely feels like the next stage
Yeah,
of
a
Yeah.
step
that
in the right
Yeah.
for
direction
we
for
as a
sure.
people.
Yeah.
I
And
feel like I could sit here and talk to y'all all day. but I'm getting the message that it's time to start wrapping things up.
I know.
We went more than 15 minutes.
We did.
We
I
did.
figured we would.
I feel great about that.
I mean, we've almost hit an
We're
hour
very
mark,
interesting
guys.
people.
You
Yeah,
are.
very
No,
we
interesting.
are.
I love everything that you guys do, and I'm so grateful that you came on today to share this with us and share this with the community. I think a lot of people aren't aware that you're there or what you offer or how much that scope of what you offer
Yeah.
Oh,
or
there's
the
so much more.
I was going to
affordability
say,
of what
we might
you
need to bring you
offer.
back
Yeah.
I
for
think I
another
think we should.
conversation.
I think we should.
Part 2.
Part
Yes.
two.
Part
Yeah, because there's so much more. We didn't even touch on PATH or
Mm-hmm.
there's another one,
IPS.
IPS, or the
FEBI,
W one.
W. We have a MASH program. We
MASH,
have
that's it,
PATH.
not W. I
It's upside
inverted
down.
my
It's fine.
Yeah.
I do things like
So
that.
employment services, homeless
Yeah,
services,
like y'all have
veteran
so
services,
many things still to talk about.
first episode psychosis. Yeah, there's so many.
If
That's our
people
fault. We
want to
talk a lot.
get to know you better or they want to see what's going on with you all, how do they do that? Are you on socials? Are you strictly a website? How can people find you?
Well, I would say
I just straight up looked at Haylee like,
website.
well,
Saw Haley's
I
eyes
was like,
explode.
Yeah.
I
Her
want people to add me on
eyelids.
Facebook.
yeah.
Not you personally, but
Yes.
organizationally.
How about-
Volunteer Behavioral Health has a Facebook page, and as well as just a website, VBHCS. VBHCS.
VBHCS.org.
Yep.
Got that?
Volunteer behavioral health. What's
Like
the
care
health?
services.
Care
System.
service.
Yeah.
Care
Mhm.
system.
And
Care system.
you have a list of all of the locations, who the directors are, how to contact them, and all of the programs that are specific to that location, because we don't have all of the programs in every
Right.
location. There are a lot of grants. So you can get all of your information from the website.
Or you can reach out to this, right? If you're listening to this podcast, you can definitely reach out.
Yes.
Yeah,
to-
we can connect
Yeah.
people
Yes.
to you
Please do.
guys.
I'll leave a stack of
and-
business cards.
Absolutely.
Yes.
And then you guys are going to have a presence at our hub facility at 1809 Memorial some, and they'll be able to reach out that way.
Yep.
And then, of course, our Nourishing the Whole coordinator, Heather, would be thrilled to connect people because she's all about services. So
Yes.
all
She
the
really
ways.
is.
She really
really
is.
is.
She really is.
Yeah.
Yes.
She'll talk to you a lot about it, even more
Yes.
than us.
Yes.
Yeah.
She's the best.
This has been awesome, guys. Seriously.
No,
Yeah.
thanks for
Thank
coming
you
on.
for
It
the
was great
opportunity
talking
to do this.
We appreciate y'all so much. And I know I said it at the beginning,
Do
but
it
I'm going to
again.
say
Do
it
it.
again.
Do it.
We thank our amazing producer, Trent Benson, who has spread the positive, bring light to what's going right. If I say it twice, it'll make up for the one time I didn't, right?